So I'm Bob McMullen. I'm at the PA department. I've been there since 2007, and thank you for letting me talk to you about flipped classroom. This is going to be a little different than the rest of the day has been. The rest of the day has been people showing you how you can use each of the various advanced technologies. You can't hear me? Now you can hear me?
Yes.
Okay. Do you want me to start over?
No, you're fine.
Okay, good. So what I want to do is more of I use what's called the cafeteria plan of technology, is what I call it, in order to teach in a flipped classroom environment in pharmacology. You can go from one end of the spectrum, which is where you stand there with no PowerPoint and just talk, all the way to the other end of the spectrum, which is kind of what I do, which is throw all the bells and whistles in there, and then the students can choose what they like and what they don't like, and hopefully come out the other end with some more knowledge. So here's the summary. The summary is I'm not going to spend an hour teaching you how to use PowerPoint or Articulate or Microsoft Excel or Respondus or Blackboard 9.1 or WebCT or Crossword Construction Kit or Turning Point clickers. But I'm going to show you how I use all of those in the flipped classroom. So if that's a little overwhelming, it's not that bad. Each of those is just a separate little thing that I've learned how to do, and I would be happy if IT ever wants to have 11 lunch and learns. I'd be happy to use each one of those on how to do this in educational settings. So let me go back. This handout, I apologize. I was under the impression, I'm learning today too. I thought that everybody in the university had what's called the G drive and the folder called LRC. So I put everything in there, and now I'm hearing that those of you, if you happen to be in Kirksville, can't get to that. So I apologize. I'll try to move that to Google Drive, because I've put a lot of different sample handouts that I use in pharmacology, as well as this handout that's here today, as well as a bunch of different literature articles that I downloaded out of the library, PDFs on flipped classrooms, the different research behind it and all. So let's compare and contrast. I'm assuming that some of you that might be listening don't know what a flipped classroom is. So let me discuss the difference between a traditional and a flipped classroom. And before I start, I want to explain my tone. Those in my colleagues have said that I have sort of a tone that seems like I'm talking down to people at times, and I don't want it to sound that way, particularly when I discuss the difference between the traditional and the flipped classroom. There's perfect reasons to use the traditional classroom. There are other reasons to use the flipped classroom. I'm not looking down my nose at anybody who chooses not to use a flipped classroom. Let me just get that out of the way before we start talking about what I see as the problems with traditional classrooms. So let me see if I can zoom in so that you guys can see this, since we don't have the handout. So in the traditional model, which is the sage on the stage model, which is the teacher comes in and gives a lecture, there's pre-class work, yeah, sure. But there's supposed to be pre-class work where the students might or might not have prior knowledge. So you might have nurses, might have paramedics, you might have people that I gave a lecture last year on diagnostic tests in neurology, so EEGs and all, and I had a student that she had done that for 10 years, so she knew way more than I did about it. And they may or may not read their reading assignments. So we all usually assign reading assignments, and I bet that not very many get read. And why do they not get read? They don't get read because they know that they're going to come into a classroom, and in the traditional sage on the stage classroom, they're not going to get challenged. Dr. So-and-so is going to stand up here and espouse their knowledge on whatever the topic is, and whether I read it or not, then I'm going to get that lecture. So during the typical class, you might have a pre-test, you might have a post-test, and you're going to have a lecture, and whoever's lecturing is the expert. Let me stop for a minute and remind you, can anybody here tell me the definition of lecture? What's the etymology of the term lecture? No? Corey, you don't know?
I don't.
Lecture comes from the Latin, the 14th century medieval Latin for lectus or lectari, which means the act of reading. Right, so when we lecture and we're reading our PowerPoint, that's a perfect lecture. We're doing just what we were supposed to do in the 14th century. So I'm hoping we're not all doing that. Then post-class is a lot of times when the learning actually takes place. So in the traditional environment, maybe some takes place beforehand. Maybe if they're paying attention as you talk, as you read, lecture to them, maybe they're learning. And then post-class is when they want that PowerPoint, because that's what's going to be on the test. They want whatever information, that's where they're going to save up the readings. And the night before the test, they're going to cram for the exam. And then as soon as the exam is over, just physiologically, we purge that information, because we're not continuing to use it after the exam. So this is kind of how I see the traditional lecture, and I don't mean to offend anybody who's doing this. I actually do this a lot too. Let's talk about the different things, because there are actually benefits of the traditional lecture. So the first one is somebody calls in sick. It's real easy to load a different PowerPoint and stand up there and talk about a different lecture. So the instructor's sick, the adjunct is sick. Great, let's change topics at the last minute, no problem. You can also present large amounts of information, and particularly where I teach in the PA school, we have a huge body of information that we want to pour into the students' heads, and the most efficient way, I almost said effective, most efficient way to do that is to open up their head and I spout it out and it falls in their head, hopefully, if they can stay awake and keep their head open long enough for me to do that. How many times have you heard the lecturers, or have you said, I know I'm going fast, but we have a lot to cover today, so just listen and try to keep up, because you'll learn it all before the test, right? So lots and lots of information. And nothing against male peacocks. I happen to like male peacocks, but the lecture is a perfect way for male peacocks to get an ego boost. So we all know people that strut around and during lecture, and that's what they like. That's their purpose, is to show that they know their information. And that's not necessarily a bad thing. Lecturers, teachers, we need appreciation. And if that's how you get your appreciation, is by imparting your knowledge, that's great. Okay? So I call that the ego boost. Now, what are some of the problems, though? So some of the problems are that students are going to arrive, they've got these varying amounts of information in their heads already. Some of them have done the pre-test, some of them came from nursing, some of them came from wherever, and they're going to be required to wait while you give them the information. The pre-test, if you give it with clickers at the beginning of the class, might show a good understanding of the information, but you've already got your PowerPoints designed. So if you give a pre-test and everybody understands what you're just about to talk about, how many people would say, oh, never mind, you can take the day off because you understand it? No, I've already designed all this. I'm going to go through the PowerPoints because it's going to be a good review, right? Unless you're using clickers, or our new tool here, during the lecture, then the students really don't have to stay on track. And our students buy a lot of shoes during class, a lot of Facebooking going on. You know, they don't have to stay on track, as long as you give that PowerPoint at the beginning. You've got to give them the PowerPoint so they know that they have the information, that's what they're going to need. And the instructors have to spend a whole lot of time creating and updating these PowerPoints. We've all known instructors that have their PowerPoint slides and they teach the same thing every year, and it's wonderful because eventually they become actors, because eventually they know the information and they know exactly what they're going to say, and they're incredible instructors because they're actors. They're giving a play, a scene. But for the rest of us, every semester we change courses. So last year I taught this, sorry, now so-and-so's left and you have to take over teaching this. So I have to make my PowerPoints again. I have to design my lecture. And then we have the snipers. Do you guys have snipers? The snipers are the students, usually the students that know more than you do or think they know more than you do about that subject, who are just waiting for you to say something. And you can always tell, because here comes the hand, yes, and they've got some question that has nothing to do with what you just talked about. So and this can be a real problem. You know, new lecturers, people that aren't familiar with the material, people who aren't experts in the material, this can be a real anxiety-producing moment when they know that that person was a respiratory therapist, they know that that person was an ICU nurse, they know that that person was a paramedic, and they know that they just caught me on something. And they're going to ask a question that I'm not going to know the answer to. Bloom's taxonomy can be a problem with the regular lecture, because with the regular lecture we're not really even getting maybe to that understanding point. We always say, we punctuate our sentences with, okay, does everybody understand? Okay, then let's move on. But unless you say, does everybody understand? Great, let's take some clicker questions and make sure you understand, then we haven't really shown that they understand. Cases. We all love cases in medicine, but even if you put up a PowerPoint that says, let's talk about this case, it's only going to give a small amount of information, and then they're only going to be able to give enough information about that case as the people are willing to raise their hand and talk about the case, or as you have A through D clicker questions to answer the case. So not a lot of interaction. And very important at AT still is IPE. It's not IPE to put students from different disciplines into Saguaro and have a teacher teach them something. IPE is learning with, from, and about other disciplines. It's not learning with other disciplines sitting in Saguaro. That's not IPE. It's learning from and about other disciplines. It's a good start to put them together. Now let's talk about the difference. The difference then in the flipped classroom is this looks more complicated, and it is. If you want to flip your classroom, like I said, it's a smorgasbord, so you can go from just, well, I'm really pretty comfortable reading the PowerPoint. And if I read the PowerPoint enough years in a row, then it becomes I'm not reading the PowerPoint anymore. I'm explaining the PowerPoint, and that's when we get the people that the students love. The students love the lecture that doesn't have to look at the PowerPoint. They say, oh, let's talk about such and such. And they're talking about the things that are on the PowerPoint. To the next step, which is let's add some interactivity, and on down the line. But that's just the lecture part. You can actually start, and with a flipped classroom, you start before the class. So the pre-class requirements is the students might still have, you're not changing the student body, so they might still have prior knowledge, or they may not have prior knowledge. They're actually more likely to read their assignments because of what's going to happen in class. So we'll get to that in just a minute. So you give them some assignments that they have to read. And really important, at least what I think is really important, there are students that love lectures. There are students that have anxiety, panic attacks if they miss the lecture and the echo is down. Because they will not learn that information. In their head, they will not learn it because they have to learn by lecture. So I made all the lectures. So from day one when I started here, I used Camtasia, now I use Articulate, to record all my lectures. So all of my lectures are recorded. Let me talk just for a minute about Camtasia versus Articulate. I don't believe we can even use Camtasia anymore. We've moved to Articulate, and it's so much better. That's not true, we can use Camtasia? Okay. Sorry, I asked IT and you said I couldn't have it. I'd like a copy of it then.
We don't buy it for you anymore.
Oh, you don't buy it, so I can use whatever I want if I write the check. Sure, okay. So, anyway, main thing, if you don't know the difference between Camtasia and Articulate, Camtasia you make basically a video, and the students can go from A to Z. I know there's other stuff you can put in there, but the easy thing is just you're capturing your PowerPoint, making a video. Whereas, and it makes it more difficult next year when they add another drug or when they change a drug. I have to go and I have to kind of clip out of the video and I have to do all this stuff. Whereas with Articulate, you're making a long stream of little bitty videos, and each slide is its own video. So it's so simple, on the fly, not on the fly, but the morning of the lecture, if something comes out in some journal that you want to change, it's so easy to go in and change the PowerPoint, re-record that slide, hit produce, and put it back up. So Articulate's way easier, I think. And there's so much, yes?
If you want to find out more about either or both and assistance in learning them, contact Bill in Mesa or Margaret in Kirksville and from our Education and Technology Development Center, and then get your licenses and show you how to access either one, how to use them, and give you the comparison.
So Mike says Bill in Mesa, Margaret in Kirksville. Perfect. All right. YouTube. There's a lot of really good stuff out there on YouTube. There's a lot of people that medical school faculty that have gone through and put their lectures, narrated their lectures, and put them up there. So you don't have to reinvent the wheel in all cases. Repetitive quizzes. I love repetitive quizzes. I really believe in what's called the test effect, the testing effect. That's that you learn from taking tests. So the more tests you take, the more you learn. So I use this little program you might have heard of called Excel, and I have figured out how to use Excel to write 3,000 questions in 3 hours. And I can write them, and I can hit a button, it's called concatenation, and then it puts it into perfect Respondus format, so that I put it then into Respondus, and it puts it right into WebCT, which is what I use right now, because I've been hearing we've been having trouble having repetitive quiz problems with Blackboard. But Respondus puts it right into Blackboard. If anybody ever wants to know how to do that, it saves you a lot of time. These are not complicated questions. These are just simple questions. And when you have a test bank of thousands and thousands of questions, then you can go in, and what the students have is they have to take quizzes, and each time they open it, it draws 15 different questions from that 1,000 questions. So every time they take it, they see 15 different questions. And you have it set, WebCT or Blackboard, you have it set to keep their highest grade. So they just keep taking it over and over. What I've actually found is some students, they don't do it. It's a waste of their time, so they take it once and they get their 15 and they move on to something else, and that's fine. And then there's other students that really find that this repetitive quizzing is a good way for them to learn. Then they have to outline a case. So we have this nice book that has all these cases. It's actually a pharmacy book. It's for pharmacist students, and so the cases are really tricky in that I like them because the patients always have these allergies to the drug that you're going to want to use. There's always going to be drug interactions. They're really, really very good cases. And to make the students read their case, I make them outline their case, and I've actually got that on the G drive too. I'll make it available somewhere. But I showed them just a very simple way that you can summarize a case on an index card, and you actually have I don't see it, sorry. So this is just a case that the student got out of the book, and they summarized it with the demographic information and the allergies and medicines and the chief complaint and the illnesses. And then on the back side, they've got the review of system and the labs and the assessment and the plan. And most people that went through medical school, PA school, learned how to do this. You can carry this around, and you can make presentations real easily. And so the students do this with their case before they come to class. And then when they come to class, they are going to get picked to present the case. So all of them have to have the case ready, because at this point I'm still asking for volunteers, and a volunteer comes up and presents the case. At some point we almost got there last class where nobody volunteered. So when nobody volunteers, then everybody who hasn't presented yet will stand up and I'll choose somebody. So they have to be ready to present their case, and they're actually doing pretty well. They're learning presentation skills as well as how to summarize the case onto an index card. And one other thing is I'm a strong proponent of gamification, and so I went out and bought a program that does crossword puzzles, and that Excel spreadsheet I told you about, I can download, once I make all those questions, I can actually download it very simply into a file that imports right into the crossword puzzle and make crossword puzzles off of all the information. So that takes probably an extra hour after I've made all those questions. In another hour I can make 20 crosswords and another 20 word searches. And some of the students think that's pretty juvenile and they don't do them. That's fine, they're not required. And other students think, wow, that's really cool, that's good, because it turns out that on the crossword puzzle, the clues are basically the same questions they're getting in the repetitive quizzes. And I forgot to show you, but this is actually what they have to learn for pharmacology. So at the beginning of each module, I use Excel again, or Google Docs, and I make a chart of all the drugs in the module that they need to know. So these are all of this is 5 pages of some sort of drugs, analgesics and rheumatology drugs. Looks like a lot of information. The students at first think it's a lot of information, and then I Xerox all the chapters out of the textbook that this came from, and I say, would you rather memorize these 300 pages, or would you rather memorize these 6 pages? And this is all the basic information that they need to know. But What have we not done yet? In terms of Bloom's taxonomy, we're memorizing. We're not really analyzing. That's what we're going to do when we come to class. So let's go back to the handout. Any questions on the pre-class stuff? I know that's a lot of stuff, and it takes a lot of work to get all the pre-class things going. Now it's time for class. So the students come in. Yes, sir, Bill?
So I'm just wondering, like the timeline of this. The class begins at some point, and there's a period of preparation before they actually go to class.
Right. So I try to put all this information up at the beginning of the semester, but that never happens. So usually my goal is they have to have all that pre-class stuff a week before the class. Right? Because I really want them to play with that stuff. And you'll see a lot of that they can do after class also. But I'd like them to be able to do some repetitive quizzing. Obviously, I want them to be able to do the readings. Some of them like doing the puzzles and working on memorizing the chart ahead of time. So I like to give them a week ahead of time. But ideally, you put it all up in Blackboard at the beginning of the course. And you say, go for it. Now they show up at class, and we usually try to do our class up in Cougar, because that works really well for flipped class. The other one is Flagstaff. You really want the students, I keep calling them patients, you really want the students to sit around a round table so they can talk and have dialogue. Unfortunately, Cougar hasn't been available this last semester, so we've been in Mesquite, and it's really difficult because the students are sitting in the front row with their computers and they're having to turn around and talk to the students behind them, and it just doesn't work as well. So a lot of a flipped classroom is actually in the classroom if you want to be effective. I give a little short scaffolding lecture of some type. I've got the handouts once again that I'll give to you. I've got a nice lesson plan that tells the students exactly what they need to do before they come to class. And then it tells them step by step by step what they need to do once they're in class. And usually that lecture, that little lesson plan I call it, has some sort of a diagram. Pharmacology, just about every topic in pharmacology can be summarized in one diagram. So I put the diagram up and I mark out the important points. I mark out the labels. And so what they start with is I'll have a little lecture on antihypertensive agents, and then they split up, they're in groups, and the first thing that the group does is they label the diagram. So that way they're labeling all the different classes of antihypertensives and seeing where in the renin-angiotensin-aldosterone and autonomic nervous system each of those works. And then they're going to go to the cases. So the next thing they do is one of the students presents the case in front of the class. Typically, they all want to ask questions about, well, why did you treat with this? Why did you treat with that? And I usually shut that down at that point because that's what they're going to talk about in their groups. So instead, I say, let's talk about the presentation. So we take 2 or 3 minutes to help that person with their presentation. And then I say, okay, obviously you're going to have questions. Why did they choose that beta blocker? Why did they choose that statin? Why did they discontinue this versus that? But they're rhetorical questions, Socratic questions. I throw them out and I say, make sure that you discuss that in your little groups. Now they're in their little groups. And what's really nice is that they've all prepared the case, so they know, because they're actually turning that card in for a grade. So that is for a grade, which requires them to prepare the case ahead of time. Now they're sitting around talking about the case, and I know that they all have some basic level of understanding of the case. They may have just copied it verbatim onto the card without even reading it, but the cases are 4 or 5 pages and the card is 5 by 7, so somehow they have to get the information out of there. Then they start answering questions. So here's some more technology. I started out by using Google spreadsheets, and I had a different question in each column, and I would unhide it and say, now in your groups, I want each group to be a row, and I want you to answer each question. And it didn't take me long to figure out that they were accidentally writing over each other's questions. So they would type this whole big thing and somebody would write over it. And they wouldn't realize it because it was over there off the screen. So then I got really demanding that you really need to type your answers in a Word doc and then copy it in there. And then I realized, why should we even do that? So now what I use is Blackboard's discussion board. And beforehand, I go through and just make a discussion topic post for all 20 questions that they have to answer. And they go in and they just answer them as discussions, which is really nice because now they're in Blackboard. If I wanted to, I could design a rubric and I could go in and actually grade those things. Right now, we don't have to do that. They take 30 minutes or so to answer these questions, to talk about the cases, and then the sage comes back. And rather than show them a PowerPoint of what the correct answers are, I try to go through each question and say, okay, so what did we find here? And it's nice also because now I've got it in Blackboard, and so you can see, I can scroll through the discussion posts and they can see what everybody else wrote also. Well, this person put them on Crestor. Why did this group, and it tells me exactly who it was, so why did this group use Crestor? Because this group down here used lovastatin. And they'll say, well, because, you know, Crestor is better, or we read in such and such, or this, that, and the other. The other one, I need to back up just a minute because Mike will be excited about this. What else is another really important objective of answering those questions as a group is finding the evidence. So they are absolutely forbidden to use the PowerPoints from that morning's lecture. That's not evidence. The evidence is I want you to use UpToDate, or I want you to use Terrascon, or I want you to use something, not Wikipedia, but they do use Wikipedia. And I let them use Wikipedia as long as they go and look it up in UpToDate and confirm it. But I want you to actually put in your answer where you found that answer. And it's so difficult to convince them that so-and-so's lecture that they just had that morning, one of the other PA faculty, that's not evidence. Just because they said it and just because it's on their PowerPoint doesn't really make it right. And it's nice because then they go to UpToDate and then they find, well, there is kind of a discrepancy. Why is there a discrepancy? Well, maybe that person, this isn't really their field. Or maybe there really is controversy over using those two drugs. Yes, Mike?
Yeah, we put together a new library page reviewing all the online farm sources in my recent tour.
Yep, they use that all the time. Yeah, so we have a page with all the farm sources. Yep, thank you.
This is a library page on the website that we just updated.
Oh, okay, I'll take a look. So after they answer the questions, then we talk about, like I said, I go through and I basically discuss the answers. I try really hard not to say, well, that's a wrong answer or that's a right answer. Instead, I let them figure out that that's a wrong answer. I let the other people in the class, now why did they put Crestor, or why would you guys not use Crestor? I shouldn't be saying that. Rosuvastatin, I'm sorry. I'm not supposed to say the trade name. So why would you use rosuvastatin? And let the rest of the class show them the error of their ways. And then finally we do a post-test. So it's nice you do a pre-test, nice to do a post-test. I just use clickers at this point. I'm real excited about our last speaker and seeing how that'll work. So that's actually the classroom portion of the flipped classroom. And then they have the post-class. In the post-class, we've got the repetitive quizzes they can continue to take. A lot of times, I actually will make a quiz over the reading that they were supposed to do for the class, and I'll have them do it post-class, and they get to take it once. So it's not repetitive. And frequently, I'll even make it open book. So once again, I'm guaranteeing that they're going through that reading at some point. Most of them have usually done it before the class starts.
Is that graded?
That's graded, right. And that's treatment guidelines or medical letter is what they go through there. They can do more readings if they need to. They can go back and study the PowerPoints from the clinical medicine course. They can go back and study whatever PowerPoint I might have shown in front of the class, you know, the little scaffolding PowerPoint. They go back and do repetitive quizzes. At this point, some of them like to do the puzzles, and they're still cramming the night before. But I'm hoping that the difference between this cramming and the traditional cramming is that they've actually gone farther up in Bloom's taxonomy at this point. By working on this in class and solving these cases, I'm hoping that they've got a better understanding, that they've actually applied, maybe analyzed, why did you do this instead of this? So they're higher up the taxonomy, and maybe they're not having to do as much cramming. If they are feeling like they're doing as much cramming, I feel like they're retaining it better. So that very last step, which was purging, I'm hoping that's not happening as much. And so far I've done this one complete year, and the students that are out on clinicals now, I haven't done a formal survey, but just from emails, they've said, wow, we remember our stuff pretty well. Yeah, it helps. What's interesting is I get emails about the cases. Remember that case we did in hypertension? I saw that exact case today. And I'll write back and say, oh, is that one that you had to do on a card? And they'll say, no, I didn't actually do that one. I did the other one. But they still remembered because that's the one that they talked about in class. And rather than buying shoes, they actually had to sit and talk. So a couple of benefits. Students with prior knowledge. Students with prior knowledge now come in, and they're still going to come in, of course, but now they have an outlet to help everybody else. So rather than pointing out the things that we're saying that are wrong, rather than waiting to snipe, and it's not always the students with prior knowledge that do that, but rather than doing that, now they're actually elevated to a somewhat of a teaching role in the group. That can be a problem though. So let me slow down for just a minute. How do you choose those groups? I'll give you some pearls on that, hard-earned pearls. I thought initially, I'll do this scientifically, and I'll take their summer 1 grades and I'll sort them from the weakest student to the best student, and then I'll make sure that every group has a weak student and a middle student and a best student and all that. And that lasted about half a term, and then what I started finding was that the 3 students that were really strong were going through the cases really fast and not really explaining the answers, and they were leaving the other 2 in the dust. And so the other 2, the weak students, weren't really saying, wait, hold on, slow down, I don't understand that. Not in all cases. In some cases, the strong students were actually teaching, but in a lot of cases, it's like, nope, this is the answer, and we'd go on, and the weak students still wouldn't understand it. So then I thought, well, it wouldn't really be right for me to mathematically put all the strong students in one group and all the weak students in one group. So what's worked best now is you just choose your own groups. You need to have 5 people in the group, and they move around. So if they end up in a group where they're not happy, they can just move the next time. And I've got about half and half. Half the groups are by GPA, and then the other half are spread out pretty well, because there are some students in the class that really like to teach. And there's actually a lot of our weaker students really respond well to peer instruction. And this is a perfect time for peer instruction. Students can review, slow down, or speed up the narrations. This is funny to listen to. Camtasia and Articulate and Echo, we echo all of our lectures. I never thought of this, but the students never listen to them at 1x speed. They put on their headphones and they put them at 2 or 3x. I sound like Mickey Mouse, but they can go through a lecture much faster, which they can't do if I'm standing here giving a PowerPoint. They can't make me talk faster, although they do, because I look at the clock, it's like, oh, I gotta go faster. Yes, sir.
Hearing it at 2 or 3 speed, does that impact comprehension?
I don't know. Be an interesting study, wouldn't it? Yeah. Does increasing the speed reduce the comprehension? Students can take the quizzes once or several dozen times, depending on their scores and their comfort with the material. Case summary by every student prior to class ensures at least minimal familiarity when they walk into class. So they have some knowledge of the case when they come in. When we do the pre-test, we can determine how much scaffolding. If I've got a PowerPoint slide, and it was funny, he said 95 slides was going to be over 3 lectures. Dr. Fiscioni shows up with 300 slides for a 3-hour lecture. So, if I've got 300 slides that I have to make through in the next 30 minutes, or next hour, 3 hours, whatever, and I give a clicker question, a clicker test, and find out that, you guys haven't got a clue, okay, then I've got to get through all 300. But if I give it and half the class really knows what's going on, I still have 300 slides that I have to get through, unless I just, and that's so frustrating. Oh, you don't need to know that, and they click on. Well, if I don't need to know it, why did you show it to me? Because then it's going to be here. But the way we're doing it with the flipped classroom is that they can go at their own pace. So when you do the pre-test, they're not going at their own pace. I'm going at my own pace, because when I do the pre-test, if I recognize, wow, I don't know what happened this week, but it doesn't look like anybody did their readings. So then my little scaffolding lecture might be a little more detailed than it normally would be. If I do the pre-test and everybody aces it, then I don't need to do the scaffolding lecture. They know what they're at. Let's get going and let's do it. Solving questions based on cases is authentic learning. This is my favorite part about this. I always ask the students, please, please write me immediately because I will buy you a steak dinner the first time a patient hands you a PowerPoint that says what's wrong with them or that says what their case is. It just doesn't happen. Doctors don't say, come in my office and let me show you a PowerPoint about the hip replacement we're going to do tomorrow. They say, no, we're going to do a hip replacement tomorrow. You need to go find it and read about it. And maybe they'll leave, if they're nice, they'll say, here, read this book or read this article. So this is authentic learning. What happens is that you have a case, you might be able to prepare it ahead of time because you can go through the patient's chart, you can take out the important information. All the patient's chart might be is just the MA's notes about the patient, but you have some initial preparation, and then you go in and you have to actually evaluate the patient and answer important evidence-based questions about the case and figure out what you're going to do. And then, most importantly, you have to sit and discuss with your colleagues why you did that. You have to be able to back up your answers. This is authentic learring. And it's very interesting, or very easy to incorporate true IPE into this. If you put an OT or a PT, a SOMA or KCOM student sitting with a PA student in Cougar around the table, they really are going to learn what each person's capabilities, what each not facility, program's capabilities, yeah. So true IPE. And once again, Bloom's taxonomy, way up the level. There are pitfalls though. And the pitfalls are, that I've done, passive learners are resistant. A lot of our students learn that, and a lot of times this is actually the smarter students. A lot of our smarter students get through college memorizing the night before the test. They are amazing memorizers. And so they don't want to spend a whole lot of time having to learn in the classroom when they could be studying something else during my class. You know, all I got to know is the stuff on this chart. I can learn that in 2 days. I'm not saying me, but if a student says, I can learn that in 2 days, then they're not going to want to put a lot of effort in to the rest of the semester. They're going to work on Ficione stuff that they have to, that's, you know, sight recognition that they have to spend more time with. Watch out with the groups, we already talked about that. Your peacocks, they might be resistant to this. A lot of lecturers are happy, they went to medical school, they went to PA school, they went to whatever school. This is the way they learned because the expert came up and told them about aortic stenosis, and that's the way it should be. And I've been here, I'm saying I in the broad sense, I've been here forever, and I've got my PowerPoints ready, and I've got my presentation, and I'm comfortable when I give it because I know what I'm talking about, and I don't really need to do all this other stuff. And that's okay. Faculty with long-standing, little changing courses might be resistant, and there's always change. And everything that goes with change is sometimes a problem. So I highly, highly recommend, if you want to do this, if a department ever wants to do this, that you find a change agent. A change agent is somebody in the department that really believes in this, that really is willing to put in the time to redesign their whole curriculum around this. And that's about all I have to say about flipped classrooms. There's definitely a lot of technology that you can use. You don't have to. You don't have to have PowerPoints, you don't have to have clickers, you don't have to have any of that. But cafeteria plan. Yes, Kurt?
Did you find it was really a change in your curriculum or just a change in how you delivered your material?
It's absolutely just a change in the material. Yeah. I do feel like the students are getting a deeper understanding of pharmacology, Bloom's taxonomy. I really feel like the way I used to teach it, here's the PowerPoint, I'm going to stand up here and talk. They were going to go learn the PowerPoint. Very few of them actually were going to go out and look up in the library case files in pharmacology to read case files about it. Nope, we got 3 other classes we have to take finals on. I trust Bob that Bob says if I learn this PowerPoint, that's what I'll know. And then we would hear students out on clinical rotations that would say, wow, I don't remember any of the pharmacology. Or we would hear students as the didactic year progressed, their concerns would be, Yeah, but which drug am I going to give for which condition? Because you're teaching me about all the classes, but I'm not going to know the specific answer when the doctor says, what drug do you give? Well, I don't know, you're going to give a penicillin. Yeah, but which one? So this way, they're actually learning classes and they're learning a number of the drugs. So for each module, they learn 50 most common drugs for cardiology or for whatever.
So you say you've done it a year, so you're in your second year?
I'm in my second year, halfway through the second year.
So obviously the first year took you some more time than it did the previous year
Yeah.
because you had to rethink it and put all your materials together. But now in your second year, is it taking you as much time, or is it kind of like back to when you were lecturing, it's you pull out your stuff, you review it, and
That's a great
you give your
question.
class
There's definitely less upfront work the second year, if you choose to be. What I'd really like to do is the next step, if you really want learner-centered education, is here's the smorgasbord. Right now, I'm choosing from the smorgasbord and saying, here's your plate of food. What I'd really like to get to the point of is at the end of each lecture, or certainly at the end of each term, I'm surveying the students and saying, so what'd you think about the crosswords? What'd you think about the repetitive tests? What'd you think about the cases? What'd you think about the index card? And I'm going to do that in the next couple of weeks. There's going to be one or two that hate everything, because there always is. But if the entire class says, wow, that whole thing with the index card is really not necessary, then maybe I'll consider taking that out, because if it's learner-centered. And just because I think they should eat index cards doesn't mean they should eat index cards. Any other questions? Curtis?
yes, online question. What have you found to be the best way to get buy-in from students when changing from the traditional to flipped format?
I start out the year with a really common case of diabetes. And I say, let's just start with, we don't go through all this other stuff first. We just start, and the first day, let's work through some cases. And they're totally lost because they didn't read the book beforehand. They've been on vacation before the class started, so they didn't read the stuff. They thought this is like college where you show up and they give you a PowerPoint and there it is. So I start out with some really simple cases in their face and say, a year from now, you're going to be in the clinic and this is what you're going to be doing. You're not going to be memorizing PowerPoints, you're going to be solving cases. So I'm going to help you learn to solve cases rather than help you learn to memorize PowerPoints. I'm going to give you PowerPoints to memorize. I'm going to give you this big chart to memorize. I'm going to give you quizzes to help you do this. I'm going to do all that. But basically, we start talking about authentic testing and authentic learning on the first day of pharmacology. And this year, I had much better buy-in. The first year is the hardest, not so much because there's so much work to do. That's easy. The work is simple. We all know how to do PowerPoints and Excel and all that, Respondus and Blackboard. The problem is taking this idea to the students and having them accept it. And the first year is the hardest one to get accepted because they've all been talking to last year's class. And last year was such and such, and why aren't we getting that? It's something different. And last year's did fine, so why are we changing it? This year was much easier because last year did it. And last year is in clinic, and they're able to say, oh yeah, those cases are great. You know, the little card, we're using that card all the time. So, anything else?
Nothing from online.
Okay. Anything here? All right, appreciate it.
Thank you.